Question 1. The evaluation methodology shows that a junior doctor has reported concerning neurological signs in a patient who is currently isolated due to infection control protocols, preventing the consultant from performing a direct physical examination. The junior doctor has provided a detailed verbal report of findings including altered consciousness, focal neurological deficits, and a history of recent head trauma. The consultant is considering the next steps in managing this patient. Which of the following actions best reflects appropriate professional judgment in this scenario? Option A. Requesting a senior colleague to attend the patient for a direct physical examination. Option B. Prescribing empirical treatment based on the reported symptoms without further direct assessment. Option C. Asking the junior doctor to repeat specific parts of the examination and relay the findings again. Option D. Relying on the junior doctor's interpretation of the findings to initiate immediate treatment. Correct answer is A. Requesting a senior colleague to attend the patient for a direct physical examination. Explanation. This scenario presents a professional challenge due to the need to accurately assess a patient's neurological status without the benefit of immediate, direct physical examination. The physician must rely on the information provided by the junior doctor, which requires critical appraisal of the reported findings and an understanding of the limitations of remote assessment. The core of the challenge lies in ensuring patient safety and appropriate clinical decision-making when direct physical contact is not feasible. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the principles of good medical practice as outlined by the General Medical Council, GMC. The GMC's guidance emphasizes the importance of doctors taking responsibility for their patients' care and making sound clinical decisions. In this context, requesting a senior colleague to perform a direct examination is the most responsible action when there is uncertainty or a lack of sufficient information to make a definitive diagnosis or management plan. This ensures that the patient receives the highest standard of care and that potential risks are minimized. It also reflects a commitment to professional accountability and the collaborative nature of healthcare. An incorrect approach of relying solely on the junior doctor's interpretation without further direct assessment would be professionally unacceptable. This would represent a failure to adequately assess the patient, potentially leading to misdiagnosis or delayed appropriate treatment, thereby breaching the duty of care owed to the patient. It could also be seen as an abdication of professional responsibility. Another incorrect approach, such as immediately prescribing medication based on a potentially incomplete or misinterpreted report, would also be professionally unacceptable. This bypasses essential diagnostic steps and could lead to inappropriate or harmful treatment, violating the principle of first, do no harm. Furthermore, it fails to acknowledge the limitations of remote assessment and the need for direct clinical judgment. The professional decision-making process in such situations should involve a systematic evaluation of the available information, an assessment of the level of certainty regarding the diagnosis and management, and a clear understanding of the potential risks and benefits of different actions. When in doubt, or when the information is insufficient for safe and effective decision-making, the professional should err on the side of caution and seek further direct assessment or consultation, as dictated by the clinical situation and professional guidelines. Question 2. Research into the management of a suspected bacterial chest infection in an immunocompetent adult patient presenting with a productive cough and fever, where local resistance data for common respiratory pathogens is readily available, leads to a discussion about the most appropriate initial management strategy. Option A. Immediately initiate broad-spectrum antibiotic therapy based on clinical suspicion alone, without obtaining microbiological samples or consulting local resistance data. Option B. Obtain sputum cultures and sensitivities, review local antibiotic resistance data, and initiate empirical broad-spectrum antibiotic therapy while awaiting results. Option C. Delay antibiotic treatment until definitive microbiological culture and sensitivity results are available, even if the patient is clinically unwell. Option D. Obtain sputum cultures and sensitivities, review local antibiotic resistance data, and initiate targeted antibiotic therapy based on the most likely pathogen and its known susceptibility patterns. The correct answer is B. Obtain sputum cultures and sensitivities, review local antibiotic resistance data, and initiate empirical broad-spectrum antibiotic therapy while awaiting results. Explanation. This scenario presents a professional challenge due to the inherent complexity of antibiotic resistance and the need for evidence-based prescribing within the UK healthcare system. Clinicians must balance the immediate need to treat a patient with the long-term imperative of antimicrobial stewardship to preserve the efficacy of antibiotics for future use. This requires a nuanced understanding of local resistance patterns, patient-specific factors, and the latest clinical guidelines. The correct approach represents best professional practice because it prioritizes a diagnostic workup to identify the causative pathogen and its susceptibility profile before initiating broad-spectrum antibiotics. This aligns with the principles of good medical practice as outlined by the General Medical Council, GMC, specifically regarding the need to provide a high standard of care and to use professional judgment. It also supports the National Strategy for Antimicrobial Resistance, which emphasizes the importance of appropriate antibiotic use. By seeking microbiological confirmation, clinician is acting in accordance with evidence-based medicine and the principles of rational prescribing, minimizing the risk of unnecessary antibiotic exposure and the development of further resistance. An incorrect approach that involves immediately prescribing a broad-spectrum antibiotic without further investigation fails to adhere to best practice. This could lead to the selection of an inappropriate agent, potentially contributing to the development of antibiotic resistance, which is a significant public health concern in the UK. Ethically, it may also represent a failure to provide the most effective and targeted treatment for the patient. Another incorrect approach, such as delaying treatment indefinitely while awaiting definitive culture results, could be detrimental to the patient's immediate health and may not be clinically justifiable in all acute situations, potentially breaching the duty of care. A further incorrect approach, relying solely on empirical treatment based on anecdotal experience rather than current local guidelines or microbiological data, risks prescribing an ineffective or overly broad agent, again contributing to resistance and potentially compromising patient care. Professionals should employ a decision-making framework that begins with a thorough clinical assessment, considering the patient's history, symptoms, and signs. This should be followed by an evaluation of available diagnostic tools, including microbiological investigations, and a review of current, evidence-based clinical guidelines and local antimicrobial prescribing policies. The decision to prescribe and the choice of antibiotic should be a considered one, balancing the immediate clinical need with the long-term implications for antimicrobial stewardship. Regular review of treatment effectiveness and adjustment based on microbiological results are also crucial components of this process. Question 3. The efficiency study reveals that a new, streamlined diagnostic pathway for suspected appendicitis can reduce average patient waiting times by 30%. Dr. Anya Sharma is reviewing a patient, Mr. David Chen, who presents with symptoms suggestive of appendicitis. The new pathway involves a single imaging modality and a shorter consultation period. Mr. Chen is anxious and has a history of complex medical conditions that might influence the interpretation of standard appendicitis symptoms. Dr. Sharma must decide how to proceed with Mr. Chen's diagnosis. Option A. Proceed with the traditional, more comprehensive diagnostic pathway, as Mr. Chen's complex medical history might not be adequately accounted for in the efficiency study. Option B. Immediately implement the new, efficient diagnostic pathway for Mr. Chen to reduce his waiting time as indicated by the study. Option C. Discuss the new pathway with Mr. Chen, explaining its potential benefits and limitations, and then collaboratively decide on the most appropriate diagnostic approach, considering his specific medical history and anxieties. Option D. Ask Mr. Chen if he would prefer the faster diagnostic pathway without further explanation to respect his potential desire for speed. The correct answer is C. Discuss the new pathway with Mr. Chen, explaining its potential benefits and limitations, and then collaboratively decide on the most appropriate diagnostic approach, considering his specific medical history and anxieties. Explanation. This scenario presents a professional challenge due to the conflict between a perceived need for efficiency, potentially driven by resource constraints or performance metrics, and the fundamental ethical duty to provide patient-centered care. The doctor must balance the potential benefits of a new, faster diagnostic pathway with the risks of compromising thoroughness and individual patient needs. Careful judgment is required to ensure that efficiency gains do not come at the expense of patient safety, dignity, or informed consent. The correct approach represents best professional practice because it prioritizes the individual patient's well-being and autonomy. Adhering to the GMC's good medical practice guidelines, particularly those concerning patient safety, communication, and consent, is paramount. This approach involves a thorough assessment of the patient's specific circumstances, a clear explanation of the proposed diagnostic pathway, and obtaining informed consent. It acknowledges that while efficiency is a consideration, it must not override the doctor's primary responsibility to the patient. An incorrect approach that prioritizes the efficiency study's findings without individual patient assessment would fail to uphold the principle of beneficence and non-maleficence, risks misdiagnosis or overlooking crucial details relevant to the individual patient, potentially leading to harm. Furthermore, proceeding without adequate explanation and consent violates the principle of patient autonomy and the GMC's requirements for clear communication. Another incorrect approach, focusing solely on the patient's stated preference without considering the evidence-based benefits of the new pathway, might also be suboptimal if the patient is unaware of potentially superior options. This could be seen as paternalistic and not fully respecting the patient's right to receive the best available care. The professional decision-making process should involve a systematic evaluation of the patient's condition, the evidence supporting the new diagnostic pathway, and the patient's values and preferences. This includes open communication, shared decision-making, and a commitment to acting in the patient's best interests, even when faced with pressures for increased efficiency. Question 4. Process analysis reveals a patient presenting with a non-healing surgical wound that exhibits persistent redness, swelling, and mild serous discharge 3 weeks post-operatively. Initial wound care has been standard. The patient reports no new systemic symptoms, but expresses concern about the lack of progress. What is the most appropriate next step in managing this patient? Option A. Advise the patient that this degree of inflammation is normal for this stage of healing and continue standard wound care. Option B. Conduct a comprehensive reassessment of the wound environment, patient's systemic health, and consider investigations for underlying causes of delayed healing. Option C. Initiate a potent systemic corticosteroid regimen to rapidly reduce inflammation. Option D. Prescribe a course of broad-spectrum oral antibiotics to address potential subclinical infection. The correct answer is B. Conduct a comprehensive reassessment of the wound environment, patient's systemic health, and consider investigations for underlying causes of delayed healing. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's inflammatory response to an injury is not resolving as expected, potentially leading to chronic inflammation and impaired healing. The professional challenge lies in accurately assessing the underlying causes of the delayed resolution and selecting the most appropriate management strategy, balancing immediate symptom relief with long-term tissue integrity and patient well-being. Mismanagement could lead to persistent pain, functional deficits, and increased risk of complications. Correct approach analysis. The correct approach involves a systematic evaluation to identify factors hindering normal inflammatory resolution and subsequent repair. This includes reassessing the initial injury, considering potential superimposed infections, evaluating the patient's systemic health, e.g., nutritional status, comorbidities like diabetes, and assessing the local wound environment for factors like foreign bodies or inadequate blood supply. Based on this comprehensive assessment, a tailored treatment plan is developed, which might involve optimizing wound care, addressing systemic issues, or, if indicated, considering anti-inflammatory or immunomodulatory therapies under appropriate medical supervision. This aligns with the General Medical Council's (GMC) guidance on good medical practice, emphasizing the need for thorough assessment, evidence-based treatment, and patient-centered care. The focus is on addressing the root cause of the delayed healing rather than solely suppressing symptoms, which is crucial for effective long-term outcomes and patient safety. Incorrect approaches analysis. One incorrect approach would be to solely focus on aggressive immunosuppression without a thorough investigation into the underlying causes of the persistent inflammation. This could mask an underlying infection or other treatable condition, potentially worsening the patient's prognosis and violating the principle of do no harm as outlined by the GMC. Another incorrect approach would be to dismiss the patient's symptoms as a normal part of healing and offer no further intervention. This fails to recognize the potential for complications and neglects the professional duty to investigate and manage patient concerns effectively, potentially leading to a breach of the duty of care. A third incorrect approach might involve prescribing broad-spectrum antibiotics without clear evidence of bacterial infection. This contributes to antimicrobial resistance and exposes the patient to unnecessary side effects, contravening the principles of rational prescribing and patient safety. Professional reasoning. Professionals should approach such cases by following a structured diagnostic and management pathway. This begins with a detailed history and physical examination, followed by appropriate investigations to identify the etiology of the delayed healing. Treatment should be evidence-based, tailored to the individual patient's needs, and regularly reviewed. Open communication with the patient about the diagnosis, treatment plan, and expected outcomes is paramount. If the initial management is not effective, reevaluation and consideration of alternative diagnoses or treatments are essential. This systematic and patient-centered approach ensures that care is safe, effective, and meets the standards expected by the GMC. Question 5. Which approach would be most appropriate when a junior doctor identifies a minor, asymptomatic anatomical variation on a diagnostic imaging report that could be mistaken for an early pathological process? Option A. Initiate a broad range of diagnostic tests to comprehensively assess all potential causes for the imaging appearance. Option B. Dismiss the finding as a common anatomical variant without further consideration, assuming it is clinically insignificant. Option C. Immediately escalate the finding for further specialist investigation to rule out any underlying pathology, regardless of the patient's symptoms. Option D. Document the finding, consider its potential clinical significance in the context of the patient's overall presentation, and discuss with a senior clinician if any doubt exists regarding its nature or management. The correct answer is D. Document the finding, consider its potential clinical significance in the context of the patient's overall presentation, and discuss with a senior clinician if any doubt exists regarding its nature or management. Explanation. This scenario presents a professional challenge due to the potential for misinterpreting subtle anatomical variations as pathological findings, leading to unnecessary investigations and patient anxiety. The physician must balance thoroughness with avoiding overinvestigation, a core principle in UK medical practice guided by the General Medical Council's GMC guidance on good medical practice, particularly concerning patient safety and professional judgment. The correct approach represents best professional practice by prioritizing a systematic and evidence-based assessment of anatomical variations. This aligns with the GMC's emphasis on maintaining up-to-date knowledge and skills, and applying them effectively to patient care. It also reflects the principle of proportionality in healthcare, ensuring that investigations are justified and not unduly burdensome to the patient or the NHS. This approach fosters trust and ensures that clinical decisions are rooted in sound anatomical understanding and diagnostic reasoning. An incorrect approach that relies solely on immediate assumption of pathology without considering anatomical variation fails to uphold the GMC's standards for professional judgment and patient safety. It risks misdiagnosis, leading to inappropriate treatment, potential harm, and erosion of patient confidence. Another incorrect approach that dismisses subtle findings without adequate consideration of potential underlying issues neglects the duty of care and the importance of thorough investigation when warranted. This could lead to delayed diagnosis of serious conditions. A third incorrect approach that involves excessive or premature referral without a clear diagnostic rationale deviates from the principles of efficient and effective use of NHS resources and can cause undue patient distress and unnecessary waiting times, contravening the spirit of good medical practice. Professionals should employ a structured decision-making process that begins with a comprehensive history and physical examination, followed by consideration of differential diagnoses that include both common pathologies and anatomical variations. This should then inform the judicious selection of investigations, always weighing the potential benefits against the risks and burdens. Continuous learning and consultation with colleagues are also vital components of this process. Question 6. The review process indicates a patient presenting with a sudden onset of fever, severe headache, photophobia, and a stiff neck. The patient also reports a rash that started on their trunk and has spread to their limbs. Considering the potential for viral pathogenesis, which of the following diagnostic and management considerations best reflects an understanding of viral replication and its impact on the host? Option A. Focus solely on symptomatic relief of headache and fever without investigating the underlying cause. Option B. Consider viral meningitis or encephalitis, prompting investigations for specific viral agents and their known mechanisms of cellular invasion and immune evasion. Option C. Initiate empirical treatment with broad-spectrum antibiotics while awaiting further investigations. Option D. Dismiss the symptoms as a common viral exanthem, advising rest and hydration without further diagnostic workup. The correct answer is C. Initiate empirical treatment with broad-spectrum antibiotics while awaiting further investigations. Explanation: scenario analysis. This scenario is professionally challenging because it involves a patient presenting with symptoms suggestive of a viral infection, requiring a clinician to differentiate between various viral pathogens and their potential complications. The challenge lies in applying theoretical knowledge of viral replication and pathogenesis to a real-world clinical presentation, ensuring accurate diagnosis and appropriate management while adhering to UK medical practice guidelines and ethical considerations. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's history, examination findings, and relevant investigations to infer the likely viral pathogen and understand its pathogenic mechanisms. This aligns with best professional practice by prioritizing evidence-based diagnosis and patient-centered care. It reflects the clinician's responsibility to apply their understanding of viral replication cycles, e.g., entry, replication, assembly, release, and how these processes lead to cellular damage and host immune responses, thereby causing the observed clinical signs and symptoms. This approach is ethically sound as it aims to provide the most accurate diagnosis and effective treatment, minimizing patient harm and maximizing benefit. In line with the General Medical Council's (GMC) guidance on good medical practice. Incorrect approaches analysis. An approach that focuses solely on symptomatic treatment without attempting to identify the underlying viral cause fails to address the root of the illness and may miss opportunities for specific antiviral therapies or management of potential sequelae. This is ethically problematic as it may not represent the most effective or comprehensive care. An approach that relies on empirical treatment with broad-spectrum antibiotics for a suspected viral infection is a significant regulatory and ethical failure. Antibiotics are ineffective against viruses, and their unnecessary use contributes to antimicrobial resistance, a major public health concern. This contravenes guidelines on antimicrobial stewardship and patient safety. An approach that dismisses the patient's symptoms without thorough investigation, assuming a benign viral illness, risks overlooking serious underlying conditions or complications of viral infections. This demonstrates a failure in clinical diligence and could lead to delayed diagnosis and suboptimal patient outcomes, violating the duty of care. Professional reasoning. Professionals should adopt a structured diagnostic process. This involves gathering a comprehensive history, performing a thorough physical examination, and utilizing appropriate investigations, e.g., serology, PCR, guided by the suspected pathogen and its known pathogenesis. Understanding the specific mechanisms by which a virus replicates within host cells and the resulting cellular and systemic effects is crucial for differential diagnosis and management planning. This systematic approach ensures that clinical decisions are evidence-based, patient-specific, and ethically justifiable, adhering to the principles of beneficence, non-maleficence, and justice as outlined by the GMC. Question 7. The analysis reveals that a patient's blood pressure is recorded as 185/110 mmHg, with a heart rate of 55 beats per minute and oxygen saturation of 92% on room air. The patient appears comfortable and is conversing normally. What is the most appropriate immediate next step? Option A. Administer a rapid-acting antihypertensive medication to lower the blood pressure. Option B. Document the readings and wait for the consultant to review the patient. Option C. Reassess the vital signs, ensuring correct technique and considering the patient's overall clinical presentation. Option D. Assume the blood pressure reading is due to equipment malfunction and proceed without further immediate action. Correct answer is C. Reassess the vital signs, ensuring correct technique and considering the patient's overall clinical presentation. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient's vital signs are outside the expected normal range, requiring immediate and appropriate clinical judgment. The professional challenge lies in accurately interpreting these findings in the context of the patient's overall presentation, understanding the potential causes, and initiating timely and effective management. It demands a systematic approach to assessment and decision-making, ensuring patient safety and adherence to clinical guidelines. Correct approach analysis. The correct approach involves a comprehensive reassessment of the patient's vital signs, considering potential confounding factors and the patient's clinical context. This includes rechecking the measurements, ensuring correct technique, and evaluating other clinical indicators such as patient comfort, level of consciousness, and any reported symptoms. This systematic reassessment is crucial for confirming the accuracy of the initial findings and for gathering further information to guide diagnosis and management. It aligns with the principles of good clinical practice, emphasizing patient safety and evidence-based care. It's mandated by professional standards and regulatory bodies like the General Medical Council, GMC, in the UK, which expects doctors to maintain their knowledge and skills and to act in the best interests of patients. Incorrect approaches analysis. One incorrect approach is to immediately administer medication based solely on the initial abnormal reading without further investigation. This bypasses essential diagnostic steps and could lead to inappropriate treatment, potentially causing harm to the patient. It fails to uphold the principle of first, do no harm, and deviates from the expected professional standard of thorough assessment before intervention. Another incorrect approach is to dismiss the abnormal reading as a potential equipment error without attempting to verify it. While equipment malfunction is possible, assuming this without rechecking the vital signs or considering other clinical signs is a failure to adequately assess the patient. It risks overlooking a genuine clinical deterioration. This approach neglects the responsibility to ensure patient well-being and could be seen as a breach of professional duty of care. A further incorrect approach is to document the abnormal reading and wait for a senior clinician to review it without any immediate action or further assessment. While escalation is important, a significant deviation in vital signs often requires immediate attention and initial management to stabilize the patient. Delaying further assessment or intervention, even with the intention of escalation, can be detrimental to patient outcomes and does not demonstrate proactive clinical responsibility. This could be considered a failure to act promptly in the patient's best interest. Professional reasoning. Professionals should approach abnormal vital signs with a structured process. 1. Acknowledge and verify. Confirm the abnormality by rechecking the vital signs using correct technique and, if possible, alternative equipment. 2. Contextualize. Evaluate the vital signs in conjunction with the patient's history, symptoms, examination findings, and known medical conditions. 3. Consider differential diagnoses. Formulate a list of potential causes for the abnormal vital signs. 4. Initiate appropriate management. Based on the assessment, implement immediate interventions to stabilize the patient and address the underlying cause. 5. Escalate and document. Communicate findings and management plans to senior colleagues or relevant teams as per local protocols, and meticulously document all assessments and interventions. Question 8. Market research demonstrates that a significant proportion of patients express a preference for less invasive treatments, even when clinical evidence suggests a more aggressive approach might yield superior outcomes. A 75-year-old patient, Mr. Smith, with a newly diagnosed early-stage malignancy, is presented with a treatment plan involving surgery and adjuvant chemotherapy, which offers the highest probability of cure according to current guidelines. Mr. Smith, however, expresses a strong desire to avoid surgery due to a fear of complications and a preference for a less intensive palliative approach, stating he wishes to maintain his quality of life for as long as possible. What is the most appropriate immediate next step for the clinician? Option A. Contact Mr. Smith's family to discuss his treatment preferences and seek their agreement to proceed with the recommended surgical and chemotherapy plan, as they may have a better understanding of his best interests. Option B. Immediately inform Mr. Smith that his preference is not clinically advisable and that the recommended treatment is the only viable option for a chance of cure, without further discussion of his concerns. Option C. Proceed with the surgical referral and chemotherapy plan as it represents the best clinical evidence for a cure, overriding Mr. Smith's expressed wishes due to his age and potential for reduced understanding. Option D. Conduct a thorough assessment of Mr. Smith's capacity to make decisions regarding his treatment, ensuring he understands the information relevant to his condition and proposed treatments, can retain that information, use or weigh it in making a decision, and can communicate his decision. The correct answer is D. Conduct a thorough assessment of Mr. Smith's capacity to make decisions regarding his treatment, ensuring he understands the information relevant to his condition and proposed treatments, can retain that information, use or weigh it in making a decision, and can communicate his decision. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a patient's expressed wishes conflict with a clinician's professional judgment regarding the most appropriate course of treatment. The challenge lies in balancing patient autonomy with the clinician's duty of care and the need to provide evidence-based medicine. Navigating this requires a deep understanding of consent, capacity, and the ethical principles underpinning medical practice in the UK. Correct approach analysis. The correct approach involves a thorough assessment of the patient's capacity to make decisions about their treatment. This means ensuring the patient understands the information relevant to their condition and proposed treatment, retaining that information, using or weighing that information as part of a decision-making process, and communicating their decision. If capacity is present, the clinician must respect the patient's decision, even if it differs from their own recommendation, provided the patient is fully informed of the risks and benefits of their chosen path and any alternatives. This aligns with the principles of patient autonomy and informed consent, which are cornerstones of UK medical law and ethical guidance, such as that provided by the General Medical Council, GMC. The clinician should also continue to offer support and explore reasons for the patient's refusal. Incorrect approaches analysis. One incorrect approach would be to proceed with the treatment against the patient's wishes without a formal capacity assessment. This is a direct violation of the principle of patient autonomy and could constitute battery. It disregards the patient's right to self-determination, a fundamental ethical and legal right in the UK. Another incorrect approach would be to dismiss the patient's concerns and insist on the clinician's preferred treatment without engaging in a discussion about the patient's reasoning or exploring their understanding. This fails to uphold the duty of care, which includes effective communication and shared decision-making. It also undermines the trust essential in the doctor-patient relationship and may indicate a failure to adequately inform the patient. A third incorrect approach would be to immediately seek legal intervention or involve a consultant without first attempting to understand the patient's perspective and assess their capacity. While escalation may be necessary in some complex cases, it should not be the first step when a patient expresses a preference that deviates from the clinician's advice, especially if the patient appears to have capacity. This bypasses the crucial steps of communication, exploration, and capacity assessment. Professional reasoning. Professionals should approach such situations by first establishing rapport and creating a safe space for open communication. The next critical step is to assess the patient's capacity to make the decision in question. This involves a structured assessment documenting the findings. If capacity is confirmed, the professional must engage in shared decision-making, ensuring the patient fully understands all relevant information, including the benefits, risks, and alternatives of all options, including no treatment. The patient's informed decision must then be respected. If capacity is lacking, the professional must act in the patient's best interests, involving appropriate family members or legal representatives, as per established legal and ethical frameworks. Question 9. Risk assessment procedures indicate that a patient experiencing severe anxiety and insomnia would benefit from pharmacological intervention. Considering the potential mechanisms of action of various anxiolytic and hypnotic medications, which approach best balances immediate symptom management with the avoidance of significant long-term adverse effects. Option A. Initiating a novel, fast-acting medication with a less established long-term safety profile but promising rapid symptom relief. Option B. Prescribing a benzodiazepine with a short half-life, carefully monitoring for dependence and withdrawal symptoms, and planning for a short duration of use. Option C. Administering a long-acting barbiturate to ensure continuous sedation throughout the night, disregarding potential for accumulation and respiratory depression. Option D. Recommending a high dose of a sedating antihistamine for its immediate calming effect, without detailed consideration of its anticholinergic burden. Correct answer is B. Prescribing a benzodiazepine with a short half-life, carefully monitoring for dependence and withdrawal symptoms, and planning for a short duration of use. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinician to balance the immediate need for symptom relief with the potential for long-term harm from a medication's mechanism of action. The patient's distress is palpable, creating pressure to act quickly. However, a thorough risk assessment necessitates understanding not just the intended effect, but also the unintended consequences of the chosen pharmacological intervention, particularly in the context of a vulnerable patient population. Correct approach analysis. The correct approach involves a comprehensive risk-benefit analysis that prioritizes patient safety and informed consent. This aligns with the General Medical Council (GMC) guidance on good medical practice, which emphasizes the importance of providing clear, understandable information to patients about their treatment options, including potential benefits, risks, and alternatives. Specifically, understanding the mechanism of action of a medication is crucial for predicting and managing side effects, especially those that could have serious or irreversible consequences. Choosing an intervention with a well-understood and manageable risk profile, or one where the benefits clearly outweigh the risks after discussion with the patient, represents best professional practice. This approach upholds the ethical principles of beneficence and non-maleficence. Incorrect approach is analysis. An approach that focuses solely on immediate symptom relief without adequately considering the medication's mechanism of action and potential long-term adverse effects fails to meet the standards of good medical practice. This could lead to iatrogenic harm, violating the principle of non-maleficence. It also fails to adequately inform the patient about the full implications of the treatment, potentially breaching the GMC's requirements for clear communication and shared decision-making. An approach that dismisses the patient's concerns or rushes to a decision without a thorough assessment of the pharmacological risks demonstrates a lack of professional diligence and empathy. This can erode patient trust and lead to suboptimal care. It also neglects the systematic approach to risk assessment mandated by good clinical practice. An approach that relies on anecdotal evidence or personal preference rather than evidence-based understanding of the medication's mechanism of action and established risk profiles is professionally unsound. This deviates from the GMC's expectation that clinicians base their decisions on current knowledge and best available evidence, potentially exposing the patient to unnecessary or inappropriate risks. Professional reasoning. Professionals should adopt a systematic approach to risk assessment that begins with a thorough understanding of the patient's condition and their individual circumstances. This includes a detailed review of the proposed treatment's mechanism of action, known efficacy, and potential adverse effects, considering the patient's comorbidities and other medications. This information should then be communicated clearly and empathetically to the patient, facilitating a shared decision-making process. The professional should be prepared to discuss alternatives and to document the rationale for the chosen course of action, ensuring it aligns with ethical principles and regulatory guidance. Question 10. During the evaluation of a couple who are planning to start a family, it is discovered that one partner is a carrier for a significant autosomal recessive genetic disorder that, if inherited by their child, would result in a severe, life-limiting condition. The couple expresses a desire to have children. What is the most ethically appropriate course of action for the healthcare professional? Option A. Withhold detailed information about the genetic disorder to avoid causing undue distress and suggest they consider adoption. Option B. Refer the couple directly to a genetic counselor without first discussing the implications and their personal concerns. Option C. Provide comprehensive information about the genetic disorder, its inheritance patterns, the implications for a potential child, and discuss all available reproductive options, including genetic counseling and prenatal testing, ensuring the couple understands their choices and can make an informed decision. Option D. Strongly advise the couple against having children due to the high risk of their child inheriting the severe genetic disorder. The correct answer is C. Provide comprehensive information about the genetic disorder, its inheritance patterns, the implications for a potential child, and discuss all available reproductive options, including genetic counseling and prenatal testing, ensuring the couple understands their choices and can make an informed decision. Explanation. Scenario analysis. This scenario presents a significant ethical dilemma for a healthcare professional. The challenge lies in balancing the patient's right to autonomy and informed consent with the potential for harm to a future child, and the societal implications of genetic screening. The professional must navigate complex ethical principles, including beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and respect for autonomy, all within the framework of UK medical law and professional guidelines. The professional's duty of care extends not only to the patient, but also, in a broader sense, to the potential offspring, creating a conflict of interest that requires careful ethical deliberation. Correct approach analysis. The correct approach involves providing comprehensive, unbiased information to the patient about the genetic disorder, its implications for their future child, and the available options, including genetic counseling and reproductive choices. This aligns with the General Medical Council's (GMC) guidance on consent and decision-making, which emphasizes the importance of providing patients with all relevant information in a way they can understand, enabling them to make informed decisions about their health care. It respects the patient's autonomy by empowering them to make choices based on their values and beliefs, while also fulfilling the professional's duty to inform and support. This approach prioritizes open communication and shared decision-making. Incorrect approach is analysis. One incorrect approach would be to unilaterally decide against offering genetic screening or to strongly advise against having children based on the patient's carrier status. This infringes upon the patient's right to autonomy and reproductive freedom, which are protected under UK law and ethical guidelines. It represents a paternalistic approach, where the professional assumes they know what is best for the patient and their potential family, overriding the patient's right to make their own informed choices. This could also be seen as discriminatory. Another incorrect approach would be to withhold information about the genetic disorder or its implications, or to present the information in a biased or alarmist manner. This violates the professional's duty to be honest and transparent with patients. It prevents the patient from making a truly informed decision and undermines the trust inherent in the doctor-patient relationship. The GMC's guidance on good medical practice clearly states the importance of clear and honest communication. A further incorrect approach would be to refer the patient to genetic counseling without first having a thorough discussion with them about their concerns, understanding of the condition, and their wishes regarding reproductive options. While genetic counseling is a crucial step, it should be offered as part of a broader conversation that respects the patient's immediate emotional and informational needs, rather than being a purely procedural referral. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. This involves 1. Identifying the core ethical and legal issues. 2. Gathering all relevant clinical and genetic information. 3. Understanding the patient's values, beliefs, and concerns through open and empathetic communication. 4. Exploring all available options and their implications, including the benefits and risks of genetic testing and reproductive choices. 5. Consulting with colleagues or ethics committees if the situation is particularly complex. 6. Documenting the discussion and the patient's decisions thoroughly. The ultimate goal is to support the patient in making a decision that is best for them, respecting their autonomy and fulfilling the professional's duty of care. Question 11. Compliance review shows a physician is seeing a patient presenting with a sore throat. The physician's notes indicate a detailed history of the sore throat, including onset, duration, severity, and associated symptoms like fever and difficulty swallowing. However, the notes do not include any questions about other body systems. What is the most appropriate next step in the patient's assessment, considering the need for a thorough clinical evaluation? Option A. Ask only about symptoms that might be directly caused by the sore throat, such as earache or headache. Option B. Defer a review of symptoms to a follow-up appointment if the sore throat does not resolve. Option C. Focus only on symptoms directly related to the sore throat to avoid overwhelming the patient. Option D. Conduct a comprehensive review of symptoms, asking about symptoms across all major body systems. The correct answer is D. Conduct a comprehensive review of symptoms, asking about symptoms across all major body systems. Explanation. Scenario analysis. This scenario presents a challenge in clinical assessment where a patient's presenting complaint might mask underlying systemic issues. The physician must navigate the risk of overlooking significant symptoms by focusing too narrowly on the immediate problem, potentially leading to delayed diagnosis and suboptimal patient outcomes. The professional challenge lies in balancing efficiency with thoroughness, ensuring all relevant areas are explored without causing undue patient distress or consuming excessive resources. Correct approach analysis. A comprehensive review of systems is crucial for identifying potential comorbidities or systemic manifestations of the patient's primary complaint. This systematic questioning, covering all major body systems, aligns with the General Medical Council's (GMC) guidance on good medical practice, which emphasizes the importance of a thorough history and examination to establish a correct diagnosis and management plan. It upholds the ethical principle of beneficence by ensuring all aspects of the patient's health are considered, thereby promoting their well-being and preventing harm from misdiagnoses. This approach is fundamental to providing holistic patient care as expected within the UK healthcare system. Incorrect approach is analysis, focusing solely on the presenting complaint without a broader review of systems, risks missing critical information that could alter the diagnosis or management. This could be considered a failure to meet the standards of care expected by the GMC, potentially leading to a breach of professional duty if a significant underlying condition is overlooked. Asking only about symptoms directly related to the presenting complaint, while seemingly efficient, is a superficial approach that neglects the interconnectedness of bodily systems. This can lead to a fragmented understanding of the patient's health and is contrary to the comprehensive assessment required for effective medical practice. Deferring a review of systems to a later appointment without clear clinical justification is inappropriate. The GMC expects timely and thorough assessments. Delaying this crucial part of the history-taking process could be seen as a failure to act in the patient's best interest and could lead to a deterioration in their condition. Professional reasoning. Professionals should employ a structured approach to patient assessment. This involves starting with the presenting complaint, followed by a systematic and comprehensive review of systems. This framework allows for the identification of potential red flags or associated symptoms that might not be immediately apparent. The decision to deviate from a full review of systems should be based on clear clinical reasoning, such as a very minor, self-limiting complaint in a previously well patient, and should always be documented. The primary goal is to gather sufficient information to formulate an accurate diagnosis and safe management plan, adhering to the principles of good medical practice and patient safety. Question 12. Compliance review shows a 65-year-old patient presenting with a 2-week history of intermittent abdominal pain, bloating, and a recent unintentional weight loss of 3 kg. On examination, there is mild tenderness in the right iliac fossa, but no masses or organomegaly. Initial blood tests reveal mild anemia. The patient has a history of type 2 diabetes and hypertension. Considering the patient's age, symptoms, and weight loss, what is the most appropriate next step in clinical reasoning and management? Option A. Prescribe a course of broad-spectrum antibiotics for suspected diverticulitis, given the right iliac fossa tenderness. Option B. Arrange for urgent imaging of the abdomen and pelvis, such as a CT scan, to investigate for underlying malignancy or other serious pathology. Option C. Reassure the patient that these symptoms are likely due to benign gastrointestinal upset and advise dietary changes. Option D. Refer the patient for a colonoscopy as the primary investigation, without further imaging. The correct answer is C. Reassure the patient that these symptoms are likely due to benign gastrointestinal upset and advise dietary changes. Explanation. This scenario presents a professional challenge due to the potential for delayed diagnosis and treatment of a serious condition, impacting patient safety and outcomes. The clinician must integrate multiple pieces of information, including patient history, examination findings, and initial investigation, to form a differential diagnosis and plan appropriate management. The core of the challenge lies in interpreting subtle or potentially misleading findings and prioritizing further investigations to confirm or refute serious possibilities. The correct approach represents best professional practice by demonstrating a systematic and evidence-based approach to clinical reasoning. It involves considering the most serious potential diagnoses first, the red flags, and initiating investigations to rule them out promptly. This aligns with the General Medical Council's (GMC) guidance on good medical practice, which emphasizes the importance of providing safe and effective care, acting in the best interests of patients, and maintaining up-to-date knowledge and skills. Specifically, it reflects the principle of putting patients first by ensuring timely and appropriate diagnostic workup for potentially life-threatening conditions. An incorrect approach that focuses solely on the most common benign diagnosis without adequately considering or investigating more serious possibilities represents a failure to adhere to the principles of good medical practice. This could lead to a delay in diagnosis, potentially resulting in irreversible harm or poorer prognosis for the patient. Ethically, it breaches the duty of care owed to the patient. From a regulatory perspective, it could be seen as a failure to meet the standards expected of a registered medical practitioner, potentially leading to a fitness to practice concern. Another incorrect approach, such as ordering a broad range of investigations without a clear diagnostic hypothesis, is inefficient and may lead to unnecessary patient anxiety, cost, and potential iatrogenic harm from investigations. While appearing thorough, it lacks the focused clinical reasoning required for effective and safe patient management. This demonstrates a lack of systematic thinking and prioritization, which are essential components of good clinical practice. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive information, history, examination, and initial results. 2. Formulate a differential diagnosis. List all plausible diagnoses, ranking them by likelihood and seriousness. 3. Identify red flags. Recognize signs and symptoms suggestive of serious or life-threatening conditions. 4. Prioritize investigations. Select investigations that will most effectively differentiate between the most serious diagnoses. 5. Develop a management plan based on the differential diagnosis and anticipated investigation results. 6. Review and reevaluate. Continuously reassess the diagnosis and management as new information becomes available. Question 13. Regulatory review indicates that a patient presents with symptoms suggestive of impaired energy production and cellular waste accumulation. A physician is considering the underlying cellular mechanisms. Which of the following approaches best reflects a comprehensive risk assessment of cellular function in this context? Option A. Assuming all cellular dysfunction is due to a general lack of ATP production without further investigation. Option B. Focusing exclusively on the nucleus and its role in gene expression. Option C. Evaluating the integrity and function of the cell membrane, mitochondria, endoplasmic reticulum, and Golgi apparatus. Option D. Attributing the symptoms solely to the absence of a cell wall. The correct answer is C. Evaluating the integrity and function of the cell membrane, mitochondria, endoplasmic reticulum, and Golgi apparatus. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting cellular function in the context of a patient's symptoms, leading to an incorrect diagnosis and treatment plan. The physician must apply their understanding of cellular biology to a real-world clinical situation, requiring a nuanced approach that goes beyond rote memorization of cellular processes. The challenge lies in integrating theoretical knowledge with practical application, considering the dynamic nature of cellular activity and its impact on overall patient health. Correct approach analysis. The correct approach involves a systematic assessment of cellular function by considering the specific cellular components and their roles in the observed symptoms. This aligns with best professional practice by ensuring that the diagnostic process is grounded in a thorough understanding of the underlying biological mechanisms. Specifically, evaluating the integrity and function of the cell membrane is crucial, as it regulates the passage of substances into and out of the cell, and its dysfunction can lead to various pathologies. Similarly, assessing mitochondrial activity is vital, as mitochondria are the powerhouses of the cell, and their impaired function can manifest as fatigue, muscle weakness, and other systemic issues. Understanding the role of the endoplasmic reticulum in protein synthesis and modification, and the Golgi apparatus in further processing and packaging, is also essential for diagnosing conditions affecting these pathways. This comprehensive cellular-level analysis allows for more accurate and targeted diagnostic and therapeutic strategy, directly reflecting the principles of evidence-based medicine and patient-centered care as expected within the UK healthcare framework. Incorrect approaches analysis. Focusing solely on the nucleus without considering other cellular organelles would be a significant regulatory and ethical failure. While the nucleus contains genetic material, cellular function is a complex interplay of multiple organelles. Ignoring the cytoplasm, mitochondria, or cell membrane would lead to an incomplete understanding of the patient's condition and potentially a misdiagnosis. This approach fails to meet the professional standard of care, which requires a holistic view of cellular processes. Attributing symptoms solely to the cell wall would be an error, as human cells do not possess cell walls. This is a characteristic of plant and bacterial cells. This demonstrates a fundamental lack of understanding of basic human cellular biology, which is a critical failure in applied knowledge and would constitute a serious breach of professional competence and regulatory expectations for medical practitioners in the UK. Assuming all cellular dysfunction is due to a lack of ATP production, without investigating specific pathways, would be an oversimplification and a failure to conduct a thorough diagnostic workup. While ATP is crucial, its deficiency can stem from various cellular issues, and a proper investigation requires identifying the root cause rather than making a broad assumption. This approach lacks the scientific rigor expected and could lead to ineffective or harmful treatment. Professional reasoning. Professionals should approach such scenarios by first identifying the patient's presenting symptoms. Then, they should consider which cellular structures and functions are most likely to be involved in producing those symptoms. This involves recalling and applying knowledge of cell biology, specifically the roles of different organelles and cellular processes. The next step is to formulate hypotheses about potential cellular dysfunction and design investigations to test these hypotheses. This iterative process of observation, hypothesis generation, and testing, grounded in a deep understanding of cellular structure and function, is essential for accurate diagnosis and effective patient management within the UK regulatory framework. Question 14. Cost-benefit analysis shows that implementing a new, more aggressive treatment protocol for a patient experiencing significant dysregulation of their core body temperature and blood glucose levels would be more expensive in the short term, but is projected to lead to a faster return to stable physiological parameters and reduced long-term complications. The patient, however, reports feeling uncomfortable with the intensity of the proposed treatment. Despite understanding its potential benefits, which of the following represents the most appropriate course of action for the medical team? Option A. Prioritize the cost savings of the less aggressive treatment, explaining to the patient that the difference in outcomes is marginal and the financial implications are paramount. Option B. Implement the aggressive treatment protocol without further discussion, assuming the patient will adapt to the discomfort given the clear medical necessity. Option C. Defer to the patient's expressed discomfort and opt for a less aggressive, more familiar treatment, even if it is less effective in restoring homeostasis and may lead to longer recovery times. Option D. Proceed with the more aggressive treatment protocol, ensuring thorough patient education and continuous monitoring for adverse effects, while also exploring strategies to mitigate the patient's discomfort. Correct answer is D. Proceed with the more aggressive treatment protocol, ensuring thorough patient education and continuous monitoring for adverse effects, while also exploring strategies to mitigate the patient's discomfort. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinician to balance the immediate, potentially life-saving benefits of a treatment with the long-term, systemic implications of disrupting a patient's natural homeostatic mechanisms, the patient's subjective experience of discomfort, and the objective physiological data, present a complex decision point where the best course of action is not immediately obvious and requires careful consideration of multiple factors. Correct approach analysis. The correct approach prioritizes the patient's immediate well-being and the restoration of physiological balance. This aligns with the fundamental ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. In the UK, the General Medical Council, GMC, guidance on good medical practice emphasizes the importance of providing effective treatments and responding to patients' needs. When a patient's homeostatic mechanisms are significantly compromised, as indicated by the symptoms and physiological markers, intervention to support or restore these mechanisms is a core aspect of medical care. This approach acknowledges that while some treatments may have side effects or temporarily alter normal function, the primary goal is to alleviate suffering and prevent further deterioration, thereby promoting overall health and recovery. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms and the physiological data as minor inconveniences and withhold treatment. This fails to uphold the principle of beneficence, as it neglects to address the patient's distress and potential for worsening condition. Ethically, it could be seen as a failure to provide adequate care, potentially breaching GMC guidelines on responding to patient needs. Another incorrect approach would be to administer a treatment that, while addressing the immediate symptom, significantly and unnecessarily disrupts other vital homeostatic processes without a clear clinical justification or a plan to manage those disruptions. This could violate the principle of non-maleficence by introducing new or exacerbating existing harms. For example, aggressively suppressing one bodily function might lead to compensatory overactivity in another, creating a cascade of dysregulation. A third incorrect approach might involve a purely cost-driven decision, prioritizing the cheapest available intervention over the most effective or safest one, even if the latter is demonstrably better for the patient's homeostatic recovery. This would be a significant ethical failure, as patient well-being must always take precedence over financial considerations in clinical decision-making, as mandated by the NHS Constitution and GMC guidance. Professional reasoning. Professionals should approach such situations by first thoroughly assessing the patient's current homeostatic state using both subjective reports and objective measurements. They should then consider all available treatment options, evaluating their potential benefits in restoring homeostasis against their potential risks and side effects, particularly concerning other homeostatic systems. This involves consulting relevant clinical guidelines and, if necessary, seeking specialist advice. The decision-making process should be patient-centered, involving open communication with the patient about the risks, benefits, and alternatives, and respecting their autonomy. The ultimate choice should be the intervention that offers the best balance of efficacy, safety, and minimal disruption to overall physiological stability, with a clear plan for monitoring and managing any adverse effects. Question 15. The efficiency study reveals that a significant number of patients diagnosed with a highly contagious respiratory illness are not adhering to isolation protocols, leading to potential community transmission. As the treating clinician, what is the most appropriate initial step to address this public health concern while respecting patient rights? Option A. Immediately report the patient's diagnosis and contact details to the local public health authority without further discussion with the patient. Option B. Discuss the diagnosis and the importance of isolation and contact notification with the patient, seeking their cooperation in preventing further spread. Option C. Inform the patient's family members about the diagnosis and the need for isolation to ensure compliance. Option D. Advise the patient to self-isolate and refrain from further discussion about their condition or potential contacts. The correct answer is B. Discuss the diagnosis and the importance of isolation and contact notification with the patient, seeking their cooperation in preventing further spread. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between public health imperatives and individual patient autonomy, particularly when dealing with highly infectious diseases. A clinician must balance the immediate need to prevent further transmission with the patient's right to privacy and informed consent. The potential for stigma and discrimination associated with certain infectious diseases adds another layer of complexity, requiring sensitivity and careful communication. Correct approach analysis. The correct approach prioritizes clear, empathetic communication with the patient about the public health implications of their condition and the necessity of notifying close contacts. This aligns with the General Medical Council, GMC, guidance on confidentiality and public health, which permits disclosure of information without consent in specific circumstances, where it is necessary to protect others from serious harm. The focus is on obtaining consent where possible, explaining the rationale for any necessary disclosures, and ensuring the patient understands their role in preventing further spread. This approach upholds both ethical principles of beneficence, acting in the patient's best interest, and the public's, and non-maleficence, preventing harm, while respecting autonomy through informed discussion. Incorrect approaches analysis. One incorrect approach involves immediately reporting the patient's diagnosis to public health authorities without attempting to discuss the situation with the patient or obtain their consent for notification of contacts. This fails to uphold the principle of patient autonomy and could breach confidentiality guidelines if not justified by immediate, severe risk that cannot be mitigated otherwise. The GMC emphasizes that disclosure without consent should be a last resort. Another incorrect approach is to solely focus on the patient's individual care and ignore the public health implications, such as failing to advise the patient on how to prevent transmission or to consider the need for contact tracing. This neglects the clinician's professional duty to protect public health, a core tenet of medical practice, and could lead to further outbreaks. A third incorrect approach is to disclose the patient's diagnosis to individuals other than designated public health officials or close contacts without the patient's explicit consent or a clear legal basis. This constitutes a breach of confidentiality and could lead to significant harm to the patient, including stigma and discrimination, and may have legal repercussions. Professional reasoning. Professionals should approach such situations by first assessing the immediate risk to public health. They should then engage in open and honest communication with the patient, explaining the diagnosis, its infectious nature, and the importance of preventing transmission. The goal is to achieve voluntary cooperation from the patient in notifying contacts and adhering to isolation measures. If the patient is unwilling or unable to cooperate, and there is a significant risk of harm to others, the clinician must then consider their professional and legal obligations to disclose information to the appropriate authorities, always acting in accordance with GMC guidance and relevant public health legislation. Question 16. Implementation of a new rapid diagnostic test for a suspected highly contagious viral pathogen in a busy district general hospital requires careful consideration of workflow integration. Which of the following approaches best ensures accurate and timely diagnosis while maintaining patient safety and public health integrity? Option A. Immediately prioritizing all samples submitted for the new test for processing, irrespective of standard laboratory workflow, to achieve the fastest possible turnaround time. Option B. Relying on initial visual inspection of samples and preliminary results from the new test kit before full laboratory validation to inform immediate clinical management decisions. Option C. Storing all positive results from the new test internally for a period to allow for a batch report to minimize administrative burden on the laboratory. Option D. Ensuring all samples are collected, labeled, transported, and processed according to established UK Health Security Agency (UKSA) guidelines and internal laboratory standard operating procedures (SOP) for the new test, with clear communication channels for urgent results. The correct answer is A. Immediately prioritizing all samples submitted for the new test for processing, irrespective of standard laboratory workflow, to achieve the fastest possible turnaround time. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical need for timely and accurate laboratory diagnosis in managing a potential outbreak of a serious infectious disease. The pressure to act quickly must be balanced with the requirement to adhere to established protocols for sample handling, testing, and reporting to ensure patient safety, public health, and the integrity of diagnostic services. Mismanagement can lead to delayed treatment, spread of infection, and erosion of public trust. Correct approach analysis. The correct approach prioritizes adherence to established laboratory protocols for sample collection, transport, and testing, as outlined by UK Health Security Agency (UKSA) guidelines and relevant professional bodies. This ensures the reliability and accuracy of diagnostic results, which are fundamental to appropriate patient management and public health surveillance. Following these protocols also aligns with the General Medical Council (GMC) guidance on good medical practice, which mandates acting in the best interests of patients and maintaining professional standards. Accurate diagnosis underpins effective treatment and containment strategies. Incorrect approaches analysis. One incorrect approach involves bypassing standard sample processing procedures to expedite results. This risks sample degradation, contamination, or incorrect testing, leading to potentially false negative or false positive results. Such a failure compromises patient care and public health, violating the GMC's duty to provide a high standard of care and the principles of evidence-based medicine. It also undermines the integrity of the laboratory's quality management system, which is subject to regulatory oversight. Another incorrect approach is to rely on preliminary or unconfirmed results from non-accredited sources for immediate clinical decisions. This deviates from established diagnostic pathways and can lead to inappropriate treatment or unnecessary public health interventions. It fails to uphold the professional responsibility to base decisions on validated and reliable information, as expected by the GMC and professional bodies governing laboratory practice. Further incorrect approach is to delay reporting confirmed positive results due to administrative backlog or lack of immediate communication channels. This directly impacts patient management, potentially allowing for further transmission of the infection and hindering timely public health responses. It represents a failure in professional duty to communicate critical information promptly and effectively, as mandated by good medical practice and public health regulations. Professional reasoning. Professionals should adopt a systematic approach, prioritizing adherence to validated protocols while simultaneously exploring legitimate avenues for expedited processing where available and appropriate within the regulatory framework. This involves understanding the specific diagnostic pathways for suspected infections, knowing the capabilities and limitations of their laboratory, and maintaining clear communication with both clinical teams and public health authorities. Decision-making should be guided by the principles of patient safety, public health, and professional accountability, always seeking to balance urgency with accuracy and regulatory compliance. Question 17. The risk matrix shows a moderate likelihood of a novel infectious agent presenting with symptoms similar to influenza in a cluster of patients presenting to the same primary care practice over a short period. The practice has limited diagnostic capacity for novel pathogens. What is the most appropriate immediate action for the clinician? Option A. Advise patients to self-isolate at home and monitor their symptoms, recommending over-the-counter remedies for symptom relief. Option B. Document the symptoms in patient records and schedule follow-up appointments for all affected patients in 2 weeks to reassess their condition. Option C. Prescribe broad-spectrum antibiotics to all patients presenting with these symptoms to preemptively treat any potential bacterial co-infection. Option D. Initiate immediate isolation protocols for all potentially affected patients and contact the local Public Health England (FE) Health Protection Team for guidance and further investigation. The correct answer is D. Initiate immediate isolation protocols for all potentially affected patients and contact the local Public Health England (FE) Health Protection Team for guidance and further investigation. Explanation. This scenario presents a professional challenge because it requires a clinician to balance immediate patient needs with the potential for long-term systemic issues affecting multiple patients. The clinician must exercise sound judgment to determine the most appropriate course of action, considering both individual care and broader public health implications. The correct approach represents best professional practice because it prioritizes patient safety and well-being by seeking expert consultation and adhering to established protocols for managing potential outbreaks. This aligns with the General Medical Council's (GMC) guidance on good medical practice, which emphasizes the importance of working within one's competence, seeking advice when necessary, and acting in the best interests of patients. Specifically, it reflects the duty to protect patients and the public by promptly addressing potential infectious diseases. An incorrect approach that involves delaying reporting or attempting to manage the situation independently without consulting relevant authorities or specialists would be professionally unacceptable. This failure would contravene the GMC's guidance on maintaining high standards of medical care and could lead to the spread of infection, endangering a wider population. It also demonstrates a lack of professional accountability and a disregard for established public health frameworks. Another incorrect approach, such as dismissing the symptoms as unrelated or minor without further investigation, would be a failure to adequately assess risk and could result in delayed diagnosis and treatment, potentially leading to severe patient harm and a breach of the duty of care. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's presentation, considering differential diagnoses and potential risks. This should be followed by consulting relevant guidelines and seeking advice from colleagues or specialists when uncertainty exists or when a serious condition is suspected. Prompt and transparent communication with appropriate public health bodies is crucial when infectious diseases are a possibility, ensuring timely intervention and containment. Question 18. Governance review demonstrates a pattern of delayed referrals for patients presenting with symptoms suggestive of acute myocardial infarction to the cardiology team, leading to suboptimal outcomes. Dr. Anya Sharma, a junior doctor, is managing a patient who is experiencing chest pain, shortness of breath, and radiating arm pain. The patient, Mr. Davies, is anxious and repeatedly states he does not want any interventions and wishes to go home. Dr. Sharma suspects Mr. Davies may not have the capacity to make this decision due to his distress and potential physiological compromise. What is the most appropriate immediate course of action for Dr. Sharma? Option A. Contact Mr. Davies' family to discuss his condition and treatment options, bypassing any formal capacity assessment for now. Option B. Administer immediate cardiac interventions without further discussion, assuming his distress impairs his judgment and that the interventions are in his best interest. Option C. Respect Mr. Davies' wishes and discharge him home immediately, documenting his refusal of treatment. Option D. Initiate a formal assessment of Mr. Davies' capacity to make decisions about his treatment, involving the multidisciplinary team, and provide supportive care while awaiting the assessment. The correct answer is D. Initiate a formal assessment of Mr. Davies' capacity to make decisions about his treatment, involving the multidisciplinary team, and provide supportive care while awaiting the assessment. Explanation. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the clinician's assessment of their best interests, particularly when the patient's capacity to make decisions is in question. The clinician must navigate the principles of patient autonomy, beneficence, and non-maleficence within the legal and ethical framework governing medical practice in the UK. The correct approach, which involves seeking a formal capacity assessment and involving the multidisciplinary team, represents best professional practice. This aligns with the Mental Capacity Act 2005, which mandates that individuals are presumed to have capacity unless proven otherwise. If capacity is uncertain, a formal assessment is required. Involving the multidisciplinary team ensures a comprehensive evaluation of the patient's condition, potential risks, and benefits of treatment, and facilitates shared decision-making where possible. This approach upholds patient dignity and rights while ensuring safe and appropriate care. An incorrect approach would be to unilaterally override the patient's wishes based solely on the clinician's opinion of what is best. This fails to respect patient autonomy and could lead to a breach of the duty of care. Another incorrect approach would be to delay necessary treatment due to uncertainty without actively pursuing a capacity assessment or involving the team, potentially causing harm to the patient. Proceeding with treatment against a patient's clearly expressed wishes without a lawful justification, such as a lack of capacity and acting in their best interests, would be a significant ethical and legal failing. The professional decision-making process in such situations should involve 1. Assessing the patient's current capacity to make the specific decision in question. 2. If capacity is uncertain or lacking, initiating a formal capacity assessment. 3. Engaging the multidisciplinary team to gather diverse perspectives and expertise. 4. Communicating openly and empathetically with the patient and their family/advocates. 5. Documenting all assessments, discussions, and decisions meticulously. 6. Adhering to relevant legal frameworks, such as the Mental Capacity Act 2005, and professional guidelines from bodies like the General Medical Council. Question 19. The monitoring system demonstrates a potential adverse drug reaction alert for a patient receiving a new antihypertensive medication. The alert flags a significant increase in serum potassium levels, which is a known but uncommon side effect of this drug class. The patient is currently asymptomatic. What is the most appropriate immediate course of action? Option A. Ignore the alert as the patient is asymptomatic and continue the current medication regimen. Option B. Review the patient's clinical status, assess the likelihood of the alert being a true adverse drug reaction, and consider reporting to pharmacovigilance if indicated. Option C. Immediately discontinue the antihypertensive medication and initiate potassium-lowering therapy. Option D. Contact the pharmaceutical manufacturer to inquire about the alert's validity. The correct answer is C. Immediately discontinue the antihypertensive medication and initiate potassium-lowering therapy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for a serious adverse drug reaction, ADR, in a vulnerable patient population. The monitoring system's alert requires immediate, informed clinical judgment to balance the benefits of continued medication against the risks of harm. The challenge lies in interpreting the alert within the context of the patient's overall clinical picture and understanding the nuances of pharmacovigilance reporting. Correct approach analysis. The correct approach involves a systematic assessment of the patient's condition, a thorough review of the medication's known side effect profile, and appropriate reporting to pharmacovigilance authorities. This aligns with the Medicines and Healthcare Products Regulatory Agency, MHRA guidelines for reporting suspected ADRs, emphasizing the importance of clinician vigilance in identifying and reporting potential safety concerns. Prompt and accurate reporting allows for the collection of real-world data on drug safety, which is crucial for updating product information and protecting public health. This approach prioritizes patient safety while fulfilling professional and regulatory obligations. Incorrect approach is analysis. Failing to investigate the alert and continuing the medication without further assessment represents a failure to act on a potential safety signal, potentially exposing the patient to further harm. This contravenes the fundamental ethical duty of care and the professional responsibility to monitor patient responses to treatment. Discontinuing the medication solely based on the alert without a clinical assessment of the patient's current status and the likelihood of the alert being a true ADR is also problematic. This could lead to unnecessary treatment interruption, potentially causing relapse or worsening of the patient's condition, and misses the opportunity to gather valuable information for pharmacovigilance. Reporting the event without a clinical assessment or consideration of causality would flood the pharmacovigilance system with potentially unverified or irrelevant data, hindering the ability to identify genuine safety signals. While reporting is important, it must be based on a reasoned clinical judgment. Professional reasoning: professionals should approach such alerts with a structured process. 1. Patient assessment. Evaluate the patient's current clinical status, vital signs, and any new symptoms. 2. Medication review. Consider the patient's medication history, dosage, duration of treatment, and known ADRs associated with the drug. 3. Causality assessment. Determine the likelihood that the observed symptoms are related to the medication, considering temporal relationship, de-challenge improvement upon stopping, and re-challenge recurrence upon restarting if ethically appropriate. 4. Decision-making. Based on the assessment, decide whether to continue, adjust, or discontinue the medication and implement appropriate management strategies. 5. Reporting. If a suspected ADR is identified, report it to the MHRA via the yellow card scheme, providing all relevant clinical details. Question 20. Investigation of a patient's response to receiving potentially distressing diagnostic results. A clinician needs to employ effective communication techniques. Which approach best balances the need for accurate information delivery with patient well-being and understanding? Option A. Focus primarily on the treatment options available, assuming the patient will understand the necessity of these based on the diagnosis, without extensively detailing the diagnostic process or its implications. Option B. Immediately present all complex diagnostic findings in detail, using precise medical terminology, and then ask if the patient has any questions. Option C. Begin by asking the patient what they already understand about their condition and what they would like to know, then deliver the information in clear, understandable language, pausing to check for comprehension and offering emotional support. Option D. Provide a brief overview of the findings, omitting some of the more serious implications to avoid causing undue anxiety, and then schedule a follow-up appointment for further discussion. The correct answer is B. Immediately present all complex diagnostic findings in detail, using precise medical terminology, and then ask if the patient has any questions. Explanation. Scenario analysis. This scenario presents a common professional challenge where a clinician must convey sensitive and potentially distressing information to a patient. The challenge lies in balancing the need for transparency and informed consent with the patient's emotional state and potential for distress. Effective communication requires empathy, clarity, and an understanding of the patient's capacity to process complex medical information. The risk assessment aspect is crucial, as the clinician must anticipate the patient's reaction and tailor their approach accordingly to minimize harm and maximize understanding. Correct approach analysis. The correct approach prioritizes patient-centered communication, ensuring the patient is informed in a way that respects their autonomy and emotional well-being. This involves a structured yet flexible conversation, starting with assessing the patient's understanding and readiness to receive information, delivering the news clearly and empathetically, allowing time for questions and emotional processing, and confirming understanding. This aligns with the General Medical Council's (GMC) guidance on good medical practice, particularly regarding communication and consent, which mandates that doctors must be able to communicate effectively with patients, provide them with the information they need to make decisions about their care, and support them in making those decisions. It upholds the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy. Incorrect approach is analysis, an approach that immediately presents all complex diagnostic information without assessing the patient's readiness or emotional state, fails to uphold the principle of beneficence. It risks overwhelming the patient, leading to confusion, anxiety, and an inability to absorb crucial details, thereby hindering their ability to participate in decision-making. This could be seen as a failure to communicate effectively as required by the GMC, an approach that avoids discussing the full implications of the findings due to fear of causing distress, or by using overly technical jargon, undermines the principle of autonomy. Patients have a right to be fully informed to make autonomous decisions about their care. This also contravenes GMC guidance on providing clear and understandable information. An approach that focuses solely on the medical facts without acknowledging or addressing the patient's emotional response neglects the holistic aspect of patient care. While factual accuracy is important, a patient's emotional well-being is integral to their overall health and their ability to engage with treatment. This demonstrates a lack of empathy and could lead to a breakdown in the doctor-patient relationship, impacting trust and adherence to medical advice. Professional reasoning. Professionals should adopt a structured approach to delivering difficult news, often referred to as a protocol for breaking bad news. This typically involves preparing for the consultation, assessing the patient's setting and perception, inviting information sharing, giving knowledge, addressing emotions with empathy, and strategizing and summarizing. The key is to remain flexible and responsive to the individual patient's needs and reactions, always prioritizing their understanding and well-being while adhering to professional and ethical standards.